All right, thank you so much first for inviting me and being part of this event. I'm truly honored. And thank you, Dr. Carl Hart, for a very enlightening and very informative talk. And I'm also thankful and grateful that Dr. Michael Tan focused more on the Philippine context. That way I don't have to. So thank you for that. So for those who don't know me, primarily I am a clinical psychologist. Yes, I am a teacher here. Primarily, I identify as a clinician, and I think I'm going to talk about it from that perspective. No? Specifically, I am a child and family therapist. Now, some of you may wonder, what has that got to do with drug use? Well, as our MC said earlier, it affects every age group. I see it in parents, I even see it in kids. But I just have some couple of points. I hope you don't mind. I have a little código here. Just a couple of points that I wanted to point out. So, again, I defer to Dr. Hart for the research and the facts. No, he's the expert at drug use, not me. Maybe what I want to talk about or respond to is the process in which we deal with the topic of drugs, right? The process or the attitude that we have. We have a tendency to put things in a binary, right? It's either black or white, good or bad, right or wrong. And when we put things in a binary, there is no room for the in-between or the third space. Somehow we have the need to categorize people or behaviors into neat, discrete boxes to simplify things because it's too much work to deal with the complexities and the nuances. And particularly as a psychotherapist, people have this need for certainty. We have to know for sure. Bottom line, is this good or bad, right? And there is a discomfort, therefore, with ambiguity and complexity. Hindi tayo mapakali if we're not sure of something, if what we're doing is absolutely right. And we are fond of using the phrase, and I hear this a lot, particularly in UP, we are fond of using the phrase, the cultural divide, right? And when we say divide, there is an assumption or a visual in our head about this line, right? So meaning breaking things into two. That's why it's a divide. And this is maybe appropriate when talking about power differentials, right? Who is on the upside of power, who is on the downside of power. However, I invite you to consider if applying this idea of divide when it comes to good versus bad, right versus wrong, right? Because when applying this binary or this divide, we are not considering the situation of those who lie in between. With oversimplification, we miss out on the nuances of the situation and ignore contextual factors. Just as Dr. Hart has said, majority of people that have used drugs are not addicted, but we have made a binary, right? If you've used drugs, you are addicted. If you haven't, then you're good, and there's no need for concern. Now, let me go into the different perspectives that I use as a therapist and I use in clinical psychology when I deal with my clients. When someone goes to me and there is a behavior that they want to change, although let's face it, usually when they come to me, it's their spouses or their parents that want their behavior to change. What I ask them first is, what is the function of this behavior? What purpose does this behavior have in their lives? And after that, and I ask this because then that defines for me what intervention to use. So the intervention in this case, particularly in child and family therapy, is to provide replacement behaviors, or what Dr. Hart terms alternative reinforcers. And in fact, I don't think it's much disputed anymore in research that using punishment solely as an intervention has never really worked. So even if you think about it from a parenting perspective, right, if all you do is punish, it doesn't really work. And we need to provide viable alternatives. Now let me go on from a family systems approach. No? We can consider or liken drugs as the identified patient of the family. And I'll talk a little bit what that means. From a systemic perspective, we need to look at systems that reinforce certain behaviors. For example, We can't talk about drug-related violence in the family without talking about domestic violence. And we can't talk about domestic violence without talking about sexism and the impact of rigid gender roles. And as well, we also can't talk about these things without talking about poverty, and we can't talk about poverty without talking about institutional policies in place that affect issues of social justice. Going at it from a systemic approach, just by that example, is very, very tiring. It's a lot of work. It's not as easy as having identified patients saying, well, drugs is bad. That is the reason why our society is in decline. And if only we solve this issue, then everything will be good. And what is the identified patient? This is a term that we use in family therapy. It is the one pointed to by the family, or in this case, the system, as the referral problem. They come to me saying, my kid has a problem. He or she, maybe, for example, is stealing, or can't sit still at school and is failing. So by focusing on the identified patient, it assumes that the family would have been happy and healthy if not for the behaviors of the identified patient. And of course, and consequently, it also then assumes that by solving the problem or the identified patient, or maybe removing the identified patient, it will result in a happily ever after. Again, this is simplistic thinking, and if life was really this way, then I say go for it. But really, does it work? It doesn't. Because in actuality, the way us clinicians look at identified patient, is that he or she, or in this case, the drug, is merely the scapegoat, or more often than not, the distraction to the more important or powerful issues affecting the family or the system. It is much easier to demonize one thing and to attribute all the ills of the system to one factor than to actually engage in the very hard work. It's not easy, in the hard work of self-reflection, self-awareness, and accountability. So when you see politicians, for example, and I mean this in a very general sense, I have now no one in mind in particular, focus on, okay, I will focus on drugs, etc. Usually, more likely than not, you see that they are up for re-election. So what issues maybe are they trying to distract us from, is my question. So if you look at things from a systemic point of view, then there is no room for blaming. There is no room for focusing on any one thing. Each member of this system, each institution contributes to this cycle, to this pattern. And each member or each institution then has the responsibility. So each one of us has the solution, and in a way, it's harder work, but it's the real work that is needed. Let me go, for example, the simple method of banning something, right? Let's say we ban, just to bring it a little bit closer to home, let's say we say, okay, let's just ban fraternities, no? Because bad things have happened around them. So banning as a method of behavior change. One, as I've said, research has shown punishment has never worked. And for one, another note, simply banning fraternities, for example, ignores the question of why students join these organizations and what purpose these organizations have in their lives. For example, maybe it brings to them a sense of community and a sense of belongingness that might otherwise be lacking. So banning such things without providing viable alternative options, right, lead to inevitable failure of your goal because you have not addressed the real reason why they engage in behaviors. In the context of family therapy, simply banning or punishing a certain behavior without careful and systematic assessment of the function of this behavior will only lead to an emergence of another behavior that might actually be more inherently destructive. For example, let's say I have a kid patient and he or she is showing depression and the parents do not allow her to express her feelings, right? Because that is not what we do. We are not an emotionally expressive culture. Parang, keep it to yourself. Don't do that. Don't cry. It is not manly to cry, for example. And so what happens, okay, you can punish or ban these things such that he or she cannot cry anymore in public, but what happens? Later on, nagkakaroon ng hair pulling, right? So if you don't address the root, you don't address the function of what this serves for the person, or in this case, what it serves for the individual, then you're missing the picture, and you might actually create more problems. And then, three more points, very briefly. From a clinician's point of view, for me, this is an ethical issue. Now, please take note, it is an ethical issue is different from a moral issue. Now, I'm not speaking from a moral point of view. But for us, our edict is do no harm. First and foremost, do no harm. And clearly, research has shown that all these policies, all these interventions that seek to criminalize drug behavior instead of getting those who do need help the help, but instead incarcerating them, this does them more harm. So for me, this is an ethical issue, no matter your moral beliefs. And what they both mentioned in this war on drugs, there is power in language. And the metaphor that we choose when we talk about drugs dictate the way we think about it. So if we think about drugs as a war on drugs, this is our enemy, then what is our response? Instead of giving people the help that they do need, instead we incarcerate them. And interestingly enough, we do have a technical definition according to the DSM for substance dependence. And this actually requires impairment of functioning, meaning, there's an inability to work or difficulty or inability to maintain meaningful relationships. Drug use alone does not meet criteria for any psychological disorder. And lastly, because I am a product of UP, I was once a student and now I am faculty, I have been told that time and time again that what makes a UP person stand out is our ability to engage in critical thinking. So I told Ines when she approached me that if there will be a place for a nuanced discussion of ideas and facts and an ability to adjust our beliefs in light of emerging scientific data, I really think it is here. And so I'm really happy that this event is held here, and I hope you guys prove me right. So thank you.